I get a lot of patients who are pretty overwhelmed by the trauma of what they've been through, whether from just an injury or the surgery that they had. And it can be pretty discouraging. And I think they've found some relief in knowing of some of the effects that that trauma has on their body in more ways than they probably realized. I was talking with a woman recently who had a total knee replacement. If you think about it, it's pretty traumatic. They cut off the end of your femur, okay? And they cut off the top of your tibia. And they're drilling holes down the shafts of those bones and rasping it out. It's like a wood shop. Instead of sawdust, you have bone dust. It's pretty intense. They've got you conked out on the table with under anesthesia. They've got a tourniquet on. It's pretty intense and traumatic. Kind of doesn't matter what it is, but for this woman, it was her knee. I began to talk with her as she apologized because she had asked me something more than once, and she had forgotten some of the instruction that I gave her and some of the exercises that she was doing at home. And I explained to her, when you have something traumatic like this happen, your body's metabolism, as far as what you're doing and how much energy you need, it ramps up a bit. The metabolic, the demands that you have in the area where you're hurt is greater, because your body isn't just trying to maintain where it is, it's actually trying to restore and replenish and function, or heal, I should say. You need to hydrate more. You need to eat well. You certainly need to sleep and get a full night's sleep. And a lot of times, a lot of those systems are off. You're not sleeping well because you hurt. Maybe you're not hydrating as well as you should because you just don't realize it. So her leg is swelling up, and because there's an imbalance with all the proteins and all the debris around her knee, that the body is essentially trying to balance out the pH with more fluid. And you need to be able to flush that out. But it affects you mentally and emotionally. They found that people in pain do not perform math functions as well. Memory is affected. And so be nice to yourself, be forgiving, be patient with yourself, and ask those around you to be patient with you as well. You're not going to remember things that people told you. You may find that your patience wears thin. And just give yourself a break. It takes quite a bit out of a person to heal. I'm Benjamin Hill with Mission Physical Therapy.